Thank you for joining us today. When a child's legs do not appear straight when standing up, we call it an angular deformity. This can be described as either bow legs or knock knees. This video will discuss knock knees and how I treat this condition in children. In most cases, when a child's legs appear knock-kneed, the legs are completely normal for the child's age and will gradually straighten out with time. Starting around age 3 to 4, when standing, children's knees may appear to knock into each other. When more significant, children may knock their knees together as they run, and sometimes will walk with their feet turned outward to compensate. By 2 years of age, most children's legs will appear straight with standing. The normal growth pattern in children goes bow-legged to straight to knock-kneed by 3 to 4 years of age. The legs return to a straight alignment again by age 7 or 8. This graph represents the normal expected alignment of a child's legs over time. Evaluation for any angular deformity begins with a physical examination and x-rays, the most common being an x-ray from the hips to the knees called a standing limb alignment. To assess the limb alignment, a line from the center of the hip to the ankle will be drawn. After age 8, this line should go through the middle of the knee joint. Knock knees can be caused by rickets in children who are overweight, but most commonly the cause is idiopathic, which means we do not know what causes it. If a child hits or knocks their knees together with activities, it can cause pain. As mentioned previously, most children will attempt to make up for this by rotating their feet outward. On this x-ray, note the overlap between the legs with standing. X-rays are obtained to look for a cause of the knock knees. If there are signs of rickets, then a pediatric endocrinologist will usually help plan the treatment. If no cause is found, then x-rays taken over time may be required to see if it is getting better or worse. Other more rare causes of bow legs or knock knees include infection and trauma. These conditions can damage the growth plate at the time they occur, and the growth plate may arrest or stop growing properly. Over time, deformity will develop that may require treatment. The patient here had a severe knee injury while playing football and developed a progressive knock-knee deformity after stabilization due to a growth arrest. If there is pain, the child is over the age of 8, and the x-rays show worsening deformity over time, then surgical correction may be required. This can be performed with either the guided growth procedure or osteotomies or bone cuts. It is important to follow a child until they are fully grown to watch for any recurrence. The guided growth technique uses small plates and screws and a child's own growth potential to slowly straighten out the leg deformity. It requires routine and frequent follow-up and often requires a second surgery to remove the plates once full correction occurs. This technique is a very powerful tool that does not require cutting bones and can be repeated if needed if the growth plates are opened. It is important to follow up as directed by your surgeon if this procedure is performed, because x-rays show when it is time to remove them. If follow-up does not occur, overcorrection can occur, requiring the same procedure to correct it. If caught early, then less invasive surgical techniques such as the guided growth procedure may be all that is needed to correct the legs. If a child is finished growing, then bone cuts will be required. In children whose growth plates are closed, osteotomies are required to correct the knock-knee deformity and prevent long-term knee pain. Most angular deformities of the legs in children are painless, will spontaneously correct without any treatment, and will not cause any long-term problems. In more serious cases, we can usually use less invasive procedures to correct the legs if caught early. Therefore, it is very important to follow up with your pediatric orthopedic surgeon as instructed. Thank you.